Last year when the pandemic hit, we really did not know what to expect, and we were afraid that perhaps the hospital would get overwhelmed the way we saw um, adult hospitals filling up and filling their intensive care units. And because of the massive disease and requirements for intensive care, actually all the Boston pediatric admissions, in other words, all the children that had to be hospitalized, came to Children's Hospital. And we saw children with COVID with a astounding variety of disease, from the pneumonia that we know classically that COVID causes, to inflammation of the brain called encephalitis that initially was very puzzling to us, and kidney disease and heart disease especially. And I remember I was on call on a weekend last spring, it was about a year ago, a little more than a year ago, and this young boy was admitted to the intensive care unit, the cardiology unit, and his heart was failing. He was diagnosed with myocarditis, meaning an inflammation of the heart muscle, as Dr. Jha said. And we have a long panel of tests that we send for this condition, particular viruses and so on. And we had, sent all of that and the blood work, etc. And then his COVID test from the PCR from the nasal swab came back positive. And the intensive care unit attending physician said, "Oh, wow, I saw a patient just like that last week." And this was our second case of MIS-C, which is an inflammatory disease that begins a few weeks after an infection with the SARS-CoV-2 virus, and it can be an infection that the child or the adolescent didn't even notice, and that they were not tested for, like in this patient. And it affects the heart, it affects other organs, it affects the clotting system of our blood, etc. And it requires intensive care unit admission in many cases. Very fortunately, protocols to treat it effectively have been developed. And overall, we are very fortunate to say that at Children's Hospital, no child has died of COVID, but we have had over 2,000 children diagnosed with it. Now, they were not all admitted for COVID. They may have, had to come in for a broken bone and were also found to be positive for COVID. But this, for example, we also had over 100 children. I'm just looking at my numbers here. Yeah, over 100 children with this inflammatory condition.
Wow.
I am telling you this to say that I never accepted the myth that children are not affected by COVID.